The coronavirus is a global story. It's a national story, but it's also very much a local story. And in Texas, the governor there is warning of greater fatalities. This is as cases continue to rise in that state. So we want to dig into what's happening in the Lone Star State. I want to bring in Renuka Rayasam. You've been keeping a close eye on developments there. You cover policy and politics in that state for Politico. You're also the author of the Politico Nightly newsletter. So you are the person to talk to, and I really appreciate it. It is clear that Governor Abbott is concerned about the numbers that he's seeing in his state, but still he's choosing to leave it up to local municipalities when it comes to issuing, a shelter-in-place mandate. Why is he doing this? It would seem that now would be the time for the governor to show a strong hand when it comes to the coronavirus, because I think the way he's handled it up to here actually isn't really proving beneficial to him, if you believe the polls anyways.
Right. So, Abbott, case counts have skyrocketed in the past couple of weeks. Texas now has more than 200,000 coronavirus cases. It's doubled in the past 17 days. So we're really seeing a spiraling of cases. And Abbott has been, Texas was one of the first states to lift the stay-at-home order, and one of the last states to put it in place. And our stay-at-home order, lasted less than a month. It was really short-lived. And a lot of city and county officials are saying we opened too quickly, too fast. And now that we're seeing case counts skyrocket and spiral out of control, and not just case counts, hospitalizations are really on the rise. The trends are looking pretty bad in Texas. There is definitely a lot of questioning of Abbott lifting of that stay-at-home order in May. And he's reversed himself, which has been really surprising. We haven't seen that from necessarily a lot of other Republican governors, but Abbott now has shut down bars. He's sort of limited capacity to some restaurants. He handed over authority to local officials to limit gatherings, which he hadn't done in the past. He said this is going to be statewide, but recently, in the past few days, he said local officials, if they want to limit gatherings and have smaller gatherings, that they can have that authority. And so we're seeing him really sort of take this threat more seriously, but that is after sort of weeks of taking control away from local leaders and opening up very quickly.
Yeah, and I think that's good, because I have been he's been very clear about his concern. But I think a lot of experts will say that the way to contain this virus is to have a widespread policy, not sort of a patchwork policy from city to city or county to county. Do you think he's feeling the pressure from members of the Republican Party not to sort of take control and have a widespread policy across the state? I'm just thinking about the way he handled the Shelley Luther case, which, just to remind people, she was the salon owner that refused to shut down her business. She was jailed, but then they changed the policy in Texas to allow salons to open earlier, and she was released, and she became a little bit of a cause célèbre for people who felt that the government was being heavy-handed in dealing with the coronavirus. I wondered if it weakened his position and he found himself particularly vulnerable to Republican pressure.
Absolutely. Abbott is navigating this crisis in a very divided Republican Party in the state. We have, a far right wing of the Republican Party, and whether or not Republican officials in Texas want to admit it, they put a ton of pressure on moderate Republicans in the state. And we've seen that from Abbott time and time again, not just in this crisis, but many others. After all, Texas Lieutenant Governor Dan Patrick talked early on in this crisis about how the elderly need to sacrifice themselves to get the economy going for young people. And, and the state's own lieutenant governor has been very skeptical of a lot of public health measures that have been called for. And Abbott is navigating that politics. And we've seen that in every step of this crisis. So, at first he sort of let local officials handle things. And then when he took control away from them and did shutdown orders, he got a lot of pressure from protesters on the right. Shelley Luther violated his own statewide shutdown order. And rather than say, she violated this order and the consequences of the consequences, he lifted the order, and he lifted the order on hair salons much earlier than was even in his own plan. And we saw this last week. Abbott issued a statewide mask mandate. So any person who isn't wearing a mask in public, it's subject to a $250 fine. There's some exceptions in there. And we've seen a lot of conservative leaders really upset about that. Some folks are suing, kind of are putting a lot of pressure on Abbott over that. And we saw one GOP lawmaker in Texas say that they want to call a special session because they think that Abbott has been overreaching in this crisis. So even as we're seeing cases skyrocket, hospitalizations grow, there's some members of the GOP in Texas who are saying that Abbott has gone too far and that his mask mandate and other steps he's taken in recent days are overreach or government overreach.
When it comes to the coronavirus, I think that many experts will say that we'll probably never be completely rid of this, but we need to sort of figure out a way to coexist with this. And coexisting has to do with the capacity of our healthcare system. Can we handle the cases when they come up? So here in Texas, we have military aid being issued to San Antonio. We have Houston hospitals saying that they are overwhelmed. What does this say about the state of hospitals in Texas?
It's bad, and so the places it's particularly bad. You're right. It's really bad in Houston, and officials there are saying that they are getting very close to running out of hospital capacity. They're sort of juggling things around. Already a week ago, Texas Children's Hospital was admitting adult patients to free up capacity for other hospitals around the state. And remember, Houston has the largest medical complex in the world, so they have a lot of hospital beds. But right now, they're being filled up with coronavirus patients. And Abbott has suspended elective surgeries in the counties that surround Houston, Dallas, Austin, and a few other counties. So even with that suspension of elective surgeries, we're seeing, really worrying trends in hospitalizations in Houston. And the other place that's really in trouble right now is the Rio Grande Valley along the border. So you're seeing a lot of cities along the border say that they don't actually have hospital capacity right now, that they've already run out, that they're airlifting patients to Dallas and other parts of the state. And so those are the parts of the state that are really suffering right now. And parts of the state where, if they continue to get more cases, which is expected, they're going to have to figure out a way to either move those patients, or we're going to have a situation like we saw in New York, and some officials are warning it's going to happen in Houston or along the border. And Austin's mayor has said that they're going to get there in about 10 to 14 days if the trends don't slow down.
And sort of the other really interesting thing about watching Texas, even if you don't live in Texas, is that, like you mentioned, Texas was sort of slow to close and reopened ahead of other states. And so you can get a sense by looking at the problems there, what to look out for in other states. And one of the issues also that Texas is dealing with is a spike in I think child care facilities amongst the adults that work there, but also amongst the children. A lot of states have started to reopen their nursery schools and daycare centers. What's happening in Texas?
Yes, cases are rising when, you said it, cases are rising among daycare workers and kids. And so, right now, kids, as we know, aren't as badly affected as the elderly, but still you don't want them getting sick and then spreading the virus to others. I mean, and this is a huge concern in Texas and across the country. I've got 2 little kids myself, and, they need childcare. And so there's a real struggle there. And you're right, this is, a bit of a canary in a coal mine. What we're seeing in Texas and the trends here, show what happens when public health guidance isn't followed very closely. And I think what's sort of fascinating in Texas right now is even with the cases skyrocketing, even with everything else happening, we're still seeing a lot of things that are open. And so, restaurants are still open. A lot of businesses are still open. What you talked about earlier with sort of tension in the Republican Party. The Republican Party of Texas is planning an in-person convention this month. They have yet to pull plans for that in-person convention. And so, whatever the worrying trends are right now, it could continue and like you said, sort of be a canary in the coal mine for the rest of the country.
Yeah. Renuka, we're really happy to have you. You know a lot about that state. Thank you so much.
Thank you for having me on.